Hello, my name is Sarah Wazorkowitz, and I'm a clinical pharmacist in infectious diseases at Advocate Lutheran General Hospital in Park Ridge, Illinois. Today I'll be discussing therapeutic updates, best practices, and barriers to care in the treatment of HIV in adult patients. By the end of this presentation, you should be able to apply existing diagnostic recommendations and criteria to practice in the management of HIV patients, review recommendations from the most current HIV treatment guidelines and some recent pertinent studies, evaluate treatment plans and suggest modifications for improvement, taking into consideration the different types of HIV, resistance patterns, differences in management depending on whether a patient is treatment experienced or naive, and finally describe the challenges and barriers to care in treating patients with HIV. Since the development of antiretroviral therapy, HIV-related morbidity and mortality have drastically decreased. Despite this fact, there continue to be millions living with HIV worldwide, including approximately 18% of patients with undiagnosed infection. Incidence is the number of new HIV infections that occur during a given year, and currently the CDC estimates that approximately 50,000 people in the U.S. are newly infected with HIV each year. Of these, most, or about 63% of these new infections occur in gay and bisexual men. Black African American men and women were also strongly affected and were estimated to have an HIV incidence rate that was almost 8 times as high as the incidence among whites. In the U.S., the HIV and AIDS epidemic is not evenly distributed across states and regions. Generally, HIV and AIDS are concentrated in urban areas, so states reporting higher rates of persons living with a diagnosis of HIV infection or AIDS usually contain major metropolitan areas where their epidemics are focused. However, some generalities about this epidemic can be understood by considering regional aspects. For example, at the end of 2009, the rate, which takes into account the size of the population by noting the number of cases per 100,000 people of persons living with an AIDS diagnosis, was highest in the Northeast, followed by the South, the West, and the Midwest, even though the estimated number of adults and adolescents living with an AIDS diagnosis was highest in the South. In 2010, blacks accounted for the largest proportion of AIDS diagnoses in all regions except the West, where whites accounted for the highest proportion of diagnoses. Most people receiving an AIDS diagnosis in 2010 or living with an AIDS diagnosis at the end of 2009 were Black, white, or Latino, which obviously reflects the majority of population groups in the United States. However, HIV and AIDS strongly affect some of the smaller population groups in the U.S., an effect that may not always be noted because of the relatively small number of cases among these groups. For example, by year-end 2009, American Indians, Alaskan Natives living in the Northeast had almost the same rate of persons living with an AIDS diagnosis as whites in this region. HIV can be detected in several fluids and tissue of a person living with HIV. It is important to understand that finding a small amount of HIV in a body fluid or tissue does not necessarily mean that HIV is transmitted by that body fluid or tissue. Only specific fluids such as blood, semen, vaginal secretions, and breast milk from an HIV-infected person can transmit HIV. These specific fluids must come in contact with a mucous membrane or damaged tissue or be directly injected into the bloodstream from a needle or syringe for transmission to possibly occur. In the U.S., HIV is most commonly transmitted through specific sexual behaviors, anal or vaginal sex, or sharing needles with an infected person. It is less common for HIV to be transmitted through oral sex or for an HIV-infected woman to pass the virus to her baby before, during childbirth, or after birth through breastfeeding. It is also possible to acquire HIV through exposure to infected blood, transfusions of infected blood products, or organ transplantation, though this risk is extremely remote due to rigorous testing of the U.S. blood supply and donated organs. The primary target for HIV are the T lymphocytes. There are 2 major types of T lymphocytes, CD4 and CD8. CD4 or helper T cells target viral and many fungal pathogens and help monocytes control intracellular organisms. CD8 or suppressor T cells